Imagine you're at home, maybe sitting on the couch, maybe getting ready for bed, and suddenly you feel your heart racing. It feels like it's out of rhythm. You put your hand to your chest, try to breathe better, look at the clock, and that question that scares so many people comes to mind. Is this anxiety, or is it something wrong with my heart? And here's a very important detail. Not every palpitation is an emergency, but some palpitations should not be ignored. Knowing this difference can prevent two dangerous extremes, panicking unnecessarily, or on the other hand, waiting too long when your body is asking for help. So, in this video, I'm going to show you what to look for when your heart races at home, what simple actions can safely help, what you shouldn't do on your own, and what signs indicate it's time to seek immediate medical attention. And stay with me until the end, because the most important tip isn't just how to calm your heart in that moment, but how to figure out why it's happening. Before we continue, please leave a like, because this type of content can help many people who experience palpitations, a racing heart, strange heartbeats. First point, when we talk about a racing heart, many people immediately think of arrhythmia, but that's not always the case. The heart can race due to anxiety, stress, fear, fever, dehydration, pain, anemia, excess caffeine, energy drinks, nicotine, cold and flu medication, thyroid problems, lack of sleep, physical exertion, and various other situations. So, the first question isn't just how many beats is it registering? The more important question is what's coming along with that? If your heart races but you are conscious, breathing well, without chest pain, fainting, significant shortness of breath, confusion, intense cold sweats, or extreme weakness, there may be time to observe calmly and take some safe measures. But if the racing heart is accompanied by chest pain or pressure, severe shortness of breath, fainting, feeling like you're going to pass out, intense dizziness, mental confusion, significant paleness, cold sweats, or a very unusual feeling of malaise, don't wait for the video to end. Seek medical help immediately. In countries like the United States and Canada, this may mean calling 911. In the United Kingdom, 999. Elsewhere, use your local emergency number or go to an emergency room, urgent care, or urgent care service. And I know many people think, but doctor, what if it's just anxiety? It could be. Anxiety can indeed accelerate the heart rate and cause palpitations. But the problem is that in the heat of the moment, you can't be absolutely certain just by feeling it. Therefore, when there are strong warning signs along with palpitations, the priority is safety. Now, let's consider the most common situation. You're at home, your heart is racing, but you don't have chest pain, you're not fainting, you're not experiencing significant shortness of breath, and you can converse normally. What should you do first? The first step is simple. Stop what you're doing. Sit or lie down in a comfortable position. Don't continue climbing stairs, don't continue driving, don't continue exercising, and don't try to test your heart to see if it can handle it. At this moment, the goal is to reduce stimuli and observe. If someone is nearby, let them know. Say, my heart is racing, I'm going to sit down for a bit and observe. This seems simple, but it's important. If the person gets worse, someone will know what's happening. If you're alone, keep your phone nearby. You don't need to panic, but you also don't need to pretend nothing is happening. Next, observe your breathing. When the heart races, many people start breathing shallowly and rapidly, as if they were fighting with their own body. This can further increase the sensation of palpitations. So, practice slow, gentle, and controlled breathing. Inhale calmly through your nose, exhale slowly through your mouth, and repeat for a few minutes. There's no need to force it, no need to hold your breath until you feel dizzy, no need to do anything aggressive. The idea is to signal to your body that you are safe. And here's a point that few people understand. Slow breathing is not a cure for arrhythmia. It doesn't replace a doctor. But it can help when the rapid breathing is being fueled by stress, anxiety, fear, tension, or excess adrenaline. And even when it doesn't completely solve the problem, it helps you think better and make decisions more clearly. Now, if you have a smartwatch, fitness tracker, blood pressure monitor, or oximeter, you can check your heart rate. But be careful. Don't become a prisoner of the number. These devices can help, but they can also be wrong. If it reads 120, 130, or more, repeat the measurement after a few minutes of rest. See if the rhythm is regular or irregular. See if it's improving or worsening. And most importantly, see how you're feeling. A heart rate above 100 beats per minute at rest is called tachycardia. But this doesn't automatically mean it's a dangerous arrhythmia. Context matters. A person with a fever may have a racing heart. A person who has drunk a lot of coffee may experience palpitations. An anxious person may see their heart rate increase. But if the heart rate is very high, appeared suddenly, doesn't improve, comes with strong symptoms, or is something new to you, seek evaluation. Now let's talk about palpitations that feel like skipped beats, jolts, a little jump in the chest, or a sensation that the heart paused, then it beats harder. Often this is related to extra heartbeats, which some people call extrasystoles. Many people experience this and get scared because it feels like the heart is skipping a beat, and the sensation can be very uncomfortable. But here's some information that will reassure many people. Extra heartbeats can happen in healthy individuals. They can appear due to stress, poor sleep, caffeine, alcohol, nicotine, dehydration, anxiety, and some medications. The problem isn't experiencing it once in a while. The problem is when it's frequent, comes with significant symptoms, or changes your usual pattern. Or if it starts to interfere with your life. If you feel these jolts from time to time, do not let it turn into despair. Sit down, breathe, observe. Now, if this is happening every day, if it's getting worse, or if it comes with dizziness, you need to investigate. If you experience shortness of breath, chest pain, fainting, or unusual fatigue, seek a medical evaluation. A professional may request an electrocardiogram, a 24-hour Holter monitor, blood tests, thyroid evaluation, and electrolyte checks. They might also check for anemia, blood pressure, and assess your medication use. The most important thing is to understand the cause. Now let's talk about something frequently searched for: maneuvers to slow down a racing heart. Perhaps you've heard of the vagal maneuver, the Valsalva maneuver, ice water, or techniques to try and stop tachycardia. These strategies exist for specific contexts, but they aren't for everyone and shouldn't be done haphazardly. Why? Because a person might think they have tachycardia when, in fact, they have another problem. They might strain themselves, get dizzy, fall, injure themselves, or worsen the situation. So, in this video, I'm not going to turn this into a tutorial for everyone to copy at home. The safest thing to do is, if you already have a diagnosis, if your cardiologist has already taught you a specific technique and told you when to use it, follow their instructions exactly. But if you've never been evaluated, if you don't know what kind of palpitations you have, if you have chest pain, shortness of breath, fainting, or severe discomfort, don't try to solve it on your own. And please, do not squeeze your neck, do not put pressure on the carotid artery area, do not take extremely cold showers, do not immerse your face in ice water without guidance, and do not strain yourself until you almost pass out. The internet is not a substitute for medical evaluation. Now, a safe measure for many people is to hydrate calmly, especially if you've gone a long time without drinking water, sweated a lot, had diarrhea, a fever, or overdid it on caffeine. Take small sips of water. You don't need to drink liters at once. And if you have fluid restrictions due to kidney disease, heart failure, or specific medical advice, follow what your doctor has already recommended. Another important point: think about the triggers from the last few hours. Did you drink a lot of coffee? Did you drink an energy drink? Did you use pre-workout supplements? Did you take cold medicine? Did you sleep poorly? Did you have a heated argument? Did you go many hours without eating? Do you have a fever? Are you anxious? Did you experience pain? Are you using nicotine? All of these things can influence your heart rate and rhythm. And here's a practical tip: write it down. Note the time it started, how long it lasted, what you were doing beforehand, and what frequency appeared on your watch or device. Note whether the rhythm seemed regular or irregular, and what symptoms accompanied it. This information can greatly help your doctor. Many people come to the appointment and say, "Doctor, my heart raced." But they often don't remember the crucial details when asked. They might not recall if they felt dizzy or if it happened after coffee or stress. These specific details make a significant difference. Now let's move on to a very important point: medication safety. If you take medication for heart conditions or anxiety, do not stop. Do not stop taking it on your own, and do not adjust the dose yourself. Always follow your doctor's specific written instructions. Do not take someone else's medication or pills from a relative. Do not mix medications just because you saw someone discussing it online. Some medications can lower blood pressure too much or interact dangerously. This also applies to supplements and natural products. Natural doesn't automatically mean safe. Stimulants, pre-workouts, and natural energy products can significantly accelerate your heart rate. If you started something new and then began experiencing palpitations, this must be taken into consideration immediately. You might wonder if you can ever try to calm yourself at home. Yes, you can, provided you're stable without warning signs. Sit down, breathe slowly, and reduce stimuli. Take small sips of water and avoid caffeine while you monitor your heart rate. Notify someone and monitor it for a few minutes. This is different from trying to treat an arrhythmia on your own. The difference is this: it's one thing to protect yourself while observing, but always seek professional medical guidance for treatment. Chest pain or cold sweats? If you feel unwell, sit down and breathe slowly. A racing heart is a message. It might be stress or caffeine, but it could be something more. Don't ignore repeated episodes. Investigate your heart, blood pressure, and habits. Understanding the cause is the safest path forward. This content is for educational purposes only. If you feel unwell now, seek medical help, listen to your body responsibly, and take care, and see you in the next video.